To get some insights on this, we're joined by Dr. Sheheda Omar, Director at Teddy Bear Foundation. Thank you very much for giving us your time as quickly as you can. What is the reason, in your view, for this surge in teenagers giving birth in the country?
So thank you for that opportunity and good evening to everybody. I think we need to appreciate and understand that this is a systemic challenge that the country is facing, and we need to look at collaboration, coordinated and integrated efforts by all government departments and civil society organizations, including families and members within the community. So the challenges that we are facing with our children and learners, and I think we are seeing the surge of an increase in teen pregnancies, but we also need to realize that we've had 10-year-olds, 11-year-olds, 12-year-olds giving birth, and they are not teenagers. They are children birthing children. So again, looking at the awareness raising, the conscientizing and the accessibility and availability of friendly resources seems to be a huge challenge for learners, for teenagers to go out and access that kind of support. The kind of responses that are elicited by the healthcare facilities, by the school authorities, is not something that would actually encourage or motivate children to seek support or guidance around contraception. That is one of the challenges. But we also need to understand that overexposure to the internet and exposure to pornography is another huge factor, where children's access to the internet is certainly a risk factor, because often they do not have a platform to process what they've been exposed to understand, and the outcome is usually that it's something that they cannot miss out on, because sex is exaggerated, it's distorted, and that's another risk factor. But we also need to look at the fact that we are surrounded by gender-based violence. There is socioeconomic challenges, transactional sex taking place as well in exchange for sexual favors. Sometimes we find that the young girls are in a situation where, because of monetary reasons, for school fees, for clothes, for essentials, for the basic needs, for the support of the family, would also provide that kind of intimacy in order to enable the sustenance of the family. So these
What
are
means
challenges that we need.
I do understand there are a whole lot of reasons why this is happening, but let's see how we can address it. What would be your suggestion to improving access to a better sex education as well as access to contraception for young teenage girls?
Well, I think if we just look at what the Minister, Honorable Joe Palapala, spoke about, the youth-friendly zones and making that more accessible. So making it accessible within the school facilities, where the children can actually feel that there's a trusting and a safe environment to get that kind of advice or guidance, access to contraception. I think the sexual reproductive health programs need to be implemented more vociferously, where children understand their rights, their responsibilities, and the access to resources, where they feel comfortable and safe, and they can actually seek any kind of support or intervention to prevent the unintended consequences of a teen pregnancy. So I think that would be the basic step to start off with. We at the Teddy Bear Foundation provide not only intervention, where we provide support programs for children who are pregnant at school, so enabling them to remain within the school structure, but also to be able to access support on coping and moving forward. I think that's an essential program, but prevention certainly is the cure for all ills or the scourge of teen pregnancy. So having children starting with a comprehensive sexuality program, as we speak now, the Department of Basic Education has implemented that. But when we speak about certain aspects of sex and sexuality, I think it needs to start even earlier, because children are already, their sexual debuts are starting much earlier. So we need to educate parents, primary caregivers, because often the resistance has come from them. it's not about encouraging children to engage in sex, but if parents are more empowered, they can communicate with their children. So it's not about communication only within the school structure, but starting within the family structure, family system, where parents are equipped and can engage with children and engage in discussions where children would feel comfortable enough. Because in the work that we've done a recent research study within children that attend schools and the schools that we've reached out to. And a lot of the learners have indicated that actually they, sort out information of sex and sexuality from their peers, from the internet, and something that needs to be done within the home environment, within the schools, within the faith-based organizations. So as a broader societal framework and structure, this
everyone
needs to be
we all have a role to play in this. Thank you very much,
Indeed.
Doctor, for speaking with us.
Thank you.